Okay, go ahead, doctor. As far as my health care goes,
Did you understand the explanation that I was giving you in terms of two problems and what the approach might be for those problems?
I understand the interpretation you gave me. I don't agree with it. I understand that, you're trying to say that I'm only limited in this part. I can't help you with the other part. I don't agree with it. I understand, the compartmentalized responsibility so that the correct action doesn't happen. I don't agree with it. I understand as a doctor taking, the Hippocratic Oath to do no harm and to keep me from injustice, seeing this injustice. I don't see that, you're doing all that under the Hippocratic Oath. But that's my opinion. So yes, I do hear you. I don't understand because I don't agree.
All right. Thank you. I need to think about what else I have to offer you.
Thank you. But in the meantime, as my primary care physician, what are we going to do about my illness? Because I can't be another week, 2 weeks still suffering with this. You want me to come back on Monday if you have a solution?
I know I won't have a solution.
So do I go home and continue to suffer without help?
I've offered you some symptomatic trial to see if that would help with
And acid.
stomach. Correct.
Well, my pee is still bad and everything else, which won't help any of that.
The urinary stuff, I think, is, as I said, it's a very long-term frustrating problem.
That's fine, and that's what's keeping me in bed and ill, so you can't help me with that.
I don't think I can help you with that now.
So then where do I go from here? Do I go to San Francisco General to get help so that they can falsely arrest me because I'm going to be videotaping? What is my option? Do I come back next week? Because, this is my health care. I need to be well.
Can I ask you, why San Francisco General? Why not one of the
San
other
Francisco
hospitals in
General
town?
is the only county hospital, isn't it? I believe I've just answered your question.
Because you need free care.
Not free care, doctor. Let's not twist things. I've paid in for all this medical care that's been denied for years. Wasn't free. I paid in for it. I didn't receive the services. It's not free. It's prepaid. There's a difference.
Certainly.
Free was the injury. Free was the harm. Free was the illegalities. Free is the non-accountability. But certainly, not the health care, because that's prepaid. And I'm still, I've prepaid, I'm disabled, I'm on my Social Security, and I can't even, like you just told me, you can't help me with, the urinary part of this. What am I doing wrong? This is prepaid. This is my health care. This is my social contract that I made to this country growing up, that I would pay in as I went along, and if I got old or disabled or sick or whatnot, that these services would be provided. Let's go to Obamacare. Obamacare means I get all these services. So let's go to Obamacare. Unless, of course, there's really no medical care, period, whatsoever in this country, and it's all an illusion. Certainly isn't my problem, doctor. I paid for my medical care all my working life. I'm disabled, on my Social Security. The part that was supposed to be there for my medical care fucked me. I have a signed confession to that effect. When I went to their quality management in Washington, D.C., they fucked me again. So I have the paperwork to that. So, we live in the same world. It's a cruel, unjust world. But it's not my problem, doctor. I'm not doing anything wrong. I'm actually doing everything right.
I don't know, as I said, I don't know really what the next steps to take for you are. I know medically what my recommendations are. I don't know what the way that you can get that covered or get those services are. I'll work on it.
And in the meantime, I'll just go home and suffer and be in bed for the next 16 hours for the next few weeks while you're working on it, and not being getting cured because I don't have any medication, right? Is that what you're saying? When it comes to my urinary?
What I'm saying is...
Well, no, thank you, because this will be on YouTube. People will see that I'm still looking for health care and still not receiving it, even from a doctor. Okay, so what's my next step? Do I come back next week when I'm still ill and wait in lines you know, to see somebody so I can get health care? Do I go to San Francisco General and get arrested like I have been in the past seeking, you know, emergency services because you can't help me with my urinary stuff? What's next?
I'd like to send you my recommendations in writing. What's the best way to do that?
You can speak with Miss Ada Smith and Miss Martinez, who is compliance and privacy. They have my email address.
It's all right to send my recommendations by email?
As long as it's all right for me to come back and question you on them and videotape it and go forward and, you know, get my health care.
Certainly, I am open to your coming back.
Well, I will be back, Doc. Without medication, I'll be back next week. I'm ill.
I hear you, but you're in a corner.
No, sir. I'm not in a corner. I paid in all my life. I'm not the one who's in the corner. No, sir. These are prepaid services. If the county screwed me out of them, then the county can pay. If Medicare screwed me out of them, then Medicare can pay. You know, whatever. But I'm going to continue to tell the truth, and I'm going to continue to point out all the guilty people who've screwed me. But it's not my problem. I'm not the one who's in the corner. I'm not the one who's broken the law repeatedly. No, sir. So, no. That representation is not true. I will come in next week. I'll show you how much of a corner I'll be in. I'll continue to come in and ask for services, and if you don't provide them, it's not me who's in the corner. I'll go down to San Francisco General, and if they arrest me, it's not me who's in the corner.
That sounds like it makes things worse, not better.
Worse is all I've had. Worse is all I've had. You just started being my doctor on 430 because of 15 years of me seeking care, the last 3 years videotaping, then finally opening up in a compliance and privacy division in CP and DPH. Where was that before? Worse? What a farce. What an absolute farce. All right, so am I to leave now?
Yes.
All right, and so you're not going to schedule another appointment for me to come in and, you know, continue to seek services?
What I'd like to do is send you the recommendations, work on figuring out whether those recommendations can be done without you having health insurance, or if there's a way for you to get health insurance. I am recommending that you go to HiCap, an organization that helps people with benefits.
I don't know anything about HiCap. You can send me that in the recommendation. I can go to them and videotape that also.
And I also want to say the recommendation also continues to be that videotaping is a barrier.
But it's not illegal. Especially under my condition. You don't know. I thought you told me earlier in the last prior videotapes that it wasn't. This is a contradiction, doctor.
This is something I need to get some clarification on myself.
So when you told me before that it wasn't, you weren't clear on it?
Correct.
And this is normally what you do with patients, is not give them information you're not clear on?
Normally I give the best information I've got.
So last time that wasn't the best information because you weren't clear, correct? Thank you. Once again, folks, just want you to see what's going on. It's not me who has the problems or playing the games. All right, and send me your recommendations, doctor, and if I don't feel well next week, I'll just come back in and wait, you know, at urgent care here to see you. What are your days of operation so I can come in at the right time?
Right now, the best day to come in is Thursday.
Well, I can't wait another week if I don't get any health care. So should I come in on Monday
You're
then?
always welcome to, as you saw in the letter from Dr. Pache. Understand I'm working with Homeless Outreach Team, not with Tom Waddell Clinic, even though it's the same space. If you want to come to Tom Waddell Clinic to the urgent care, as the letter said, you're welcome to come in. His opinion is that you're not allowed to video.
That can be his opinion. He can have me falsely arrested then, just like I've been falsely arrested in the past. I will continue to videotape that to show the inhumanity in the healthcare system. You know, you guys are the ones who labeled me. You guys are the ones who screwed me. I have a signed confession, and now you guys are trying to do it again by not being accountable.
So
It's not my problem.
I'm not going to recommend that as something that's good for your health.
Excuse me, what has been good for my health for the last 12 to 15 years with me seeking health care and you not being able to acknowledge the past failures and anything else? I mean, you know, you can't recommend, you know, for me to continue this way, but, you know, it's only been because I've been continuing this way that I've even gotten this far. Can you see the insanity in that, doctor? I hear you. I know.
I can speak to again, my recommendation that it's a barrier.
Okay. And my recommendation is that it's not my problem. You guys labeled me. You guys screwed me. Now you got to be accountable. So I will be in next week if I don't get any care. Thank you. Well, folks, I'm leaving without medication. Mind you, I'm ill and I'm leaving without medication. Are we learning the games? Is it because I asked for something wrong? Is it because I've not told the truth? Or is it because it's all rigged? Keep watching the videos.